talking about face scans or 3D, we as a lab, we are not only resellers for intraoral scanners like 3Shape, Medit, or Electra. It's very important that we do this because then we have the knowledge of these devices, but also the technology and the software, and we can assist you on using those. And that's why we also became reseller for the Ray Face face scanner. And this is this beautiful device, which has different cameras in those arms, capturing actually the face very easy in less than 1 second. It's a single shot capture, and then you have your 3D face scan available in the software. Nice to know is that there is one camera in the middle which captures the oral environment very, very detailed. So you see here on the picture, the mesh actually is very accurate. And we need this in the software for the alignment step between the actual face scan and then our intraoral scanners. So you can go directly to 3Shape or Medit Cloud, find your patient scans, and then in the software, it's actually really a matter of seconds to align those two together, to merge those files in one image, in one 3D image. And here you can see in this cross section how accurate the actual match is between your intraoral scans and the face scan. So this is all done automatically, AI generated by the Ray Face software. And what is really nice now, it also offers us automatically all the reference planes and very important, the virtual face bow. So by aligning the intraoral scans, the arches in the face of the patient, in the skull of the patient, we have actually a virtual face bow. And this is, of course, really important for our treatment plan. So you see it here, the reference planes and also the 3D orientation of the intraoral scans in the face scan. Why is this important? Inconsistency of this orientation, inconsistency of the bite information in general, based on just 2D images, can really create a lot of problems, and we all know them, a shift of the horizontal line because there was inconsistency in bite information. So this can all be avoided if you go 3D using face scanners and aligning your intraoral scanners. And even as an extra feature in the Ray software, you also can use Ray Fusion. So you can also integrate DICOM, CBCT, and then align these scans also with your intraoral scan and the face scan. So this is a little bit more, let's say, for high-end, maybe surgery, maxillofacial surgery, orthodontic osteotomies, for instance, where they can really prepare everything in this virtual environment, but also, of course, interesting to communicate on interdisciplinary treatment plans, for instance, between the surgeon and the orthodontist, or for instance, to prepare implant surgery. You can also segmentate all the different structures and every individual tooth. So you can also virtually extract a tooth and place an implant here in this virtual environment. So this is a very nice tool, but maybe a little bit over the top for, let's say, the general practitioners. But still, for general practitioners, this 3D face scan, this avatar gives you a lot of added value, because we have the patient here in the natural head position. That's the first thing. We have the digital face bow, as I explained, so the correct 3D orientation of the occlusal plane in the face. And this is, of course, very, very important for different treatments, because then we have the correct start point for any prosthetic treatment, but also for orthodontics, for aligned treatments. If the inclination, the axis of the front teeth, for instance, is not perfectly aligned, which is virtually impossible on a 2D image, you don't have the correct start point, and actually you cannot really evaluate a treatment plan. So this is really an added value to have this correct 3D orientation and this digital face bow. On top, you have all the reference planes, and of course, your designs can start now facial driven. So this means for the first time, we have the patient always on board. The patient is there. We can plan on the face in this 3D environment. This was actually always the problem in the lab. Sometimes we didn't even know if the patient was male or female, so there was no indication on the gender, age, etc. Now we see the patient in the lab, and we can also perform a real nice face-driven smile design. So this will, of course, the smile design will fit the patient better, more individual, and this will also help the concentrate that the patient actually in the end agrees with the treatment plan. So correct treatment plans, more predictable treatment plans for different indications, prosthodontic, implant work, ortho, or combinations. So why is this so important, these face-driven restorations? Well, actually, it always starts from the face. We are not creating nice teeth only, we are creating a new smile for this full rehabilitation cases, for instance, an all-on-X case, or a denture also, just a removable denture. This should be started always, create a smile from the face. We have to look at the shape of the entire face, at the midline, the reference planes, and then decide on this to determine the proper size, shape of the actual teeth in the design. So it makes it maybe a little bit more complex, but using these new software tools, it's all quite straightforward, easy procedure. We use the golden ratio, and then this leads really to better treatment plans, better smile designs, and an increased concentrate. Always follow the logical steps. It's not because we go digital now that we can forget this interdisciplinary strategy. First, looking at the position of the jaws, then in a second phase, look at the position of the teeth. So first move the jaws if necessary, then move the teeth, then look at are there some teeth missing? Do we have to place implants? Looking at the next step is the relation and the vertical dimension. Then do we need to perform crown lengthening, gingivectomy, and then at the final stage is the restorative only. And it's not because we think digital today that we can forget this workflow. Often we see cases where implants are already placed, and then the patient and then the question comes, can we start an aligned treatment here? So it's the other way around. We really need to follow this strategy, and digital tools help us to show the patient, to convince the patient also in this multidisciplinary, in this combi treatment cases. So we create always digital. That's the first step with our scanners, with our face scanners. Then we communicate also digital, because the smile design offers us the possibility to do this. And this is a tool which helps there really to finally come from the CAD, the design, towards the manufacturing, to the CAM, so we can convert then after approval to CAM, which means execution, production, and finally milling or printing or whatever to produce the final solution. So talking about face scanners is of course really nice, but we also know that these are expensive devices, and that's why we are also following up what is happening on the market today. And for some time we've been looking at this Clone app, which is available in the App Store, which was already a nice tool, just a 3D scanner for daily objects. But this company actually invested in dental now and improved dramatically their in their software. This means now they came out with the new version, Clone Dental Pro. And in this Clone Dental Pro, it's available in the App Store. You need an iPhone 12 or higher, and then you can perform with your normal iPhone a really very good, decent face scan, and for a very good price. And we, as Modern Dental and all our branches, are offering also the possibility to purchase this through us at the price of 149 euros only per year. So this is an annual subscription where you can make as many face scans as you want for 1 year. It's very easy. It's only 20-30 seconds scanning around the face, and then you zoom in on the oral zone, and then you see that actually the mesh is also quite detailed here. It's very comparable actually to Rayface, which is amazing, and they did an amazing job here in quality if you see these results. Of course, the whole software as we have it, as we see it in this Rayface device, this is not available. We cannot automatically align with the intraoral scans or incorporate CBCT, etc. But we can do all this in our Smile Design software, in the exocad Smile Creator. So you can just send us the face scan, send us the intraoral scans, and we can merge them together in exocad to perform the Smile Design. So the assembly of what we have seen in the Rayface, the face scan, and the various planes, we do this in the lab in exocad. And of course, why do we need to do this? We've seen this here also in exocad. Then, if we play with the transparency of the image, you can see we also get this perfect virtual face bow, the 3D correct orientation of the arches in the face, and that's actually what we need. And similar to what we have been doing analog for many years with the classic face bow. Okay, so this is in exocad then, and there we use this data, also the vertical dimension of occlusion to design prosthetics with much greater precision, with the perfect position on the mounting table. And this is of course still in a virtual articulator using average values, but still we have all the data available. For individual values, we will talk about 4D in 2 seconds. Just to inform you, to give you the full picture, if you are interested in purchasing this in the App Store, you just download it in the App Store, then you go to the menu, click on the 3 dots, and then you send feedback, and then you can it opens a mail window, and there you can just type modern dental premium and your client number, or the lab like Elysee, Labocast, Permadental, DD Dental, Southern Cross, all the labs from our group are in this premium option, and then you can actually send the mail. You get a mail back which contains a link. If you click on the link, then you automatically upgrade to premium, and you can start using your phone as a face scan. Really easy. We invoice you 149 euros. If you would buy it in the App Store, of course, that's also possible, but then you pay 50 euros more. Nice app. It's very easy to use, and it gives an incredible detailed mesh and very high quality of face scan. And of course, we use it, but you can also use it, for instance, in MeditLink. There you can also just in a few steps align the face scan with your intraoral scanners and have this perfect 3D orientation or virtual face bow available. So really, really interesting, this new app, using, of course, AI and algorithms to filter out the movement of your phone and also the movement of the patient face when performing the face scan. So very nice. And to make the story complete today, we have to go after 3D to 4D. And 4D, this is the dimension of time when we register the movement of the jaw, the individual movement of this patient, and this can be done also with different devices today. For instance, the Mojo is a very known device, and this Mojo is actually, it's an advanced digital tool which really captures the jaw movement using 4D technology. So it enables really precise tracking of the mandibular movements, and this makes, of course, the diagnostics better, the treatment plan individual, and more precise and better overall. So how does it work? It just uses, I will play the video again, optical tracking to really record the dynamic jaw movements. You see also from both condyli the envelope of movement, and there you can also compare left and right condyles to see if you have maybe disorders which should be addressed in the treatment or during the production or fabrication of, for instance, a denture, an All-on-X work to prevent premature contacts and chipping, etc. So very interesting. This is the next level. The next step is all can be integrated also in the Exocad software, so we can also add this to the smile design. Mojo is one option. The Ray face will also offer dynamic occlusion very soon. So there you can also go left, right, protrusion, retrusion movement and register this. Everything can be segmented in the software. And then you can also look from various angles, look at the movement and the envelope of movement of the condyli, and just use this in your smile design. So these are all new technologies which take it one step further than the average value articulator. This is really individual, patient-centered treatment and smile design. So actually the whole story, everything we have been discussing up to now is about smile design and also actually about visualization. It's about the power of visualization, because we are taking the patient into a visual process where they already see the treatment, see the end result, and try to convince them to consent to the plan, to the treatment plan, which can sometimes be difficult. But this kind of digital tools, mock-ups of the new smile, can really help us to get there. So actually smile design, and for sure this integrative smile design, where you see 3D, 4D integration, this is already today a part of the future of dentistry. It's really transforming dentistry, and it allows dentists to really create precise, individual smile simulations, leading to higher consent rate of treatment plans, and of course a satisfying end result, a satisfying treatment overall experience for our patients.